So I was born and raised in Colorado, and then for college, I ended up going to Gonzaga University in Spokane, Washington. And when I entered the university, I really wanted to go into medicine, but I got a job or a position there where I started doing research, and I realized that my strengths were largely in research. And some of the mentors I had there suggested that I look into infectious diseases. And so when I graduated, I got a fellowship in I got a fellowship through the Centers for Disease Control, and that placed me in Little Rock, Arkansas, where I worked on diagnostics of infectious diseases. And my mentor there, he did a postdoc at St. Jude, and so he really recommended that I look into joining St. Jude as a graduate student and potentially as a postdoc. And so ultimately that was what I did. I came to Memphis to be able to work in infectious diseases at St. Jude. Because of the mentorship and because it's a world-renowned infectious disease program.
And when folks, obviously St. Jude, we always think about cancer research, but infectious diseases, influenza viruses, and when we think of infectious diseases, that's one of the first ones that pops to mind. Can you give us a few more infectious diseases that are more common, but of course everybody immediately goes to influenza. Other ones that you've been working on in your career.
So my career is largely focused on influenza viruses. Other diseases or infections that can affect children are largely RSV and parainfluenza viruses. But we largely focus on influenza in our lab. And the reason it's such a big deal at St. Jude is because a lot of the children are immunocompromised, whether through their treatment or through their cancers. And so our goal is to try and help prevent those infections as well as treat them more effectively so that their main focus can be on the cancer that they're being treated for here.
It's really kind of a supplemental care to everybody's focused on the cancer treatment, but like you said, when you do radiation, chemotherapy, those types of things, and it limits how much your body can fight back against any other infections. There's infectious diseases all over the country and on every little door handle. The germs are everywhere. So again, being able to, I guess, find ways to protect the kids and the patients themselves is just another. Like it's not even a secondary battle. Like I said, it's a supplementary battle because that can be just as dangerous as the cancer itself.
It can be. Infectious diseases can be catastrophic to some of these patients.
Yeah, and we hear those all the time of someone that had an immunocompromised they get the flu and they're in the hospital. Those complications, you always hear complications arose from X, Y, and Z, and that's where you run into a lot of those problems.
Correct. Yes, that's very true.
As far as, your experiences with childhood cancer and how has it shaped your decision to go into medicine and to wind up here at St. Jude?
I think it has. So I was 3 when I was diagnosed with a retinoblastoma, which is a tumor in the eye. So I don't remember a whole lot from that experience, but growing up, I could see how emotional my parents became when they were discussing it with family or friends. And they relayed how important the care team was in helping them get through it as well as helping me. And so I think that was kind of what shaped my idea into going into medicine, was that I wanted to be able to have that influence on someone else.
Like I said, it's for you. There's not necessarily that many core memories, but you can. A lot of times we may not remember what was happening to us at the times, but we remember seeing the faces and the emotions of our parents and our family during that time. And like I said, it strikes emotion and it motivates you to do new and good positive things.
Absolutely. Even today, when I discuss it with my parents, they get very, very emotional about the trials and tribulations that they went through when I was getting treated.
Yeah, and so you also see that in the faces of the families here in so many instances, whether you're working on the clinical side of things or whether you're working on the research side of things. There's so many times you just see them, even as we've been on campus here this morning, you see the moms get out with their kids getting ready to go in for treatment, and there are a lot of emotions that go around that.
Absolutely.
As far as talking about it, we've talked about infectious diseases, influenza, Again, this is a cancer hospital. We kind of went into the specifics about how we have to educate the patients, but also continue to work towards fighting these infectious diseases. Are there any types of treatments or I guess, practices that are going on right now where those two researches go hand in hand, the cancer research and the infectious diseases, or are there many different opportunities for those pieces of research to go hand in hand?
So There are lots of different programs that are focused on that, but one of the big ones that I'm interested in is the Translational Immunology and Immunotherapy Initiative. So I think it's called the TI3 initiative here, and it's a really brilliant idea of using the host or the person's immune system, so the T cells in that person, to target cancer cells and to fight them off. And so there are lots of benefits to this. As many people probably know, a lot of cancer therapies are toxic to the patients. And so this is using your own immune system, which reduces a lot of that toxicity. And St. Jude pioneered this type of treatment back in the early 2000s. And I think it was first used in patients in 2018 to treat leukemia.
Wow.
Hopefully someone can correct me if that's wrong.
No, I mean, like I said, it's one of those things where, and we talk about it all the time. We've heard it on campus about how one research aspect can then eventually be, well, wait a minute, it may not work here, but boy, we could use this somewhere else. Or this worked here, and now let's try it here, 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 and here, and see what it helps. And then you branch off another treatment from that. Are those the aha moments that you guys come across that just keep you motivated in this?
Absolutely. And this, the TI3 initiative is really a cross-center or cross-institution collaboration. It includes folks from immunology, infectious diseases, oncology, cellular therapy or cell biology, computational biology. It includes everyone. And I think it's a really powerful initiative that's going on here, and something that will really drive cancer therapy in the future.
And we've heard this word so much today in our tours and stuff like this: collaboration, collaboration, collaboration. Not just within the campus itself, but across the country, across the world. You know, you guys share that treatment. When you come up with something, you know, it goes out to everywhere it can go to help kids, to help patients, not just kids, patients across the world. How often do you guys sit in a room collaborating and you get to pat each other on the back and go, hey, we're on to something here? Does it happen? Are we talking weekly, monthly, or sometimes you may have a dry stretch where you're still trying to figure things out, and then maybe a couple of times in a couple of weeks? How many times do you guys get to shake hands, fist bump, and pat each other on the back?
Well,
or do you guys do that? I guess is probably the best way to describe it.
I don't know if there's a lot of fist bumping going on, but we do collaborate with international colleagues all the time. I probably get numerous emails from international colleagues, and recently we had a lot of discussions with folks from the World Health Organization regarding influenza viruses, and probably emailed numerous times even through Christmas and the month of December. But we are right now gearing up for developing or selecting the new vaccine strains for the influenza viruses. That meeting will occur here in the end of February.
Gotcha. I guess they're virtual fist bumps when you think about it that way. I was really thinking more fist bumps when you collaborate with people on campus. Because via email, it's like, yeah, you could do the little emojis, but yeah, it doesn't really work that way.
We do meet with, so every 6 months we have these the vaccine strain selection meetings where we get to meet with colleagues internationally, but we also have meetings. And then on campus, we're frequently visiting immunology, whether it's to use a piece of their equipment or for discussing an idea that they may have or we may have. So on campus, it happens quite frequently.
And again, like I said, to meet with people abroad and across the world, it's one thing, but to sit in here and collaborate with the folks that you may see every couple of months or couple of weeks, it's got to be a treat too as well.
Absolutely.
This is an easy question, I think, that most folks know, but to get the answers from the experts, influenza viruses, infectious diseases in general, what's the best ways to prevent those?
The best way to prevent them is to get vaccinated. And a lot of times we think of vaccination just to protect ourselves, but it also helps to protect those around you. So like we've discussed, a lot of the patients are immunocompromised, and so a vaccine may not work well with them if their immune system's not working well, but But if we get vaccinated, we can kind of form a ring of protection around them. So we can help prevent us from getting sick, help their parents from getting sick, their siblings, and that will help protect them from being exposed to some of these viruses.
The cascading effect of if we protect the outer ring, then the second most inner ring is protected, then the inner ring's protected, then the patient's protected. And that's the most important thing. Vaccines continue to improve. Flu vaccines and the like continue to improve. Are we getting close to a universal flu vaccine?
I think we're getting closer. I don't know how close we are, but there are a lot of different ideas on how to accomplish this. What we saw with SARS is the new RNA-based vaccines, and those are being developed for influenza now. We also see a lot of viral-like particles being developed for influenza vaccines, and also using more of the traditional methods, but targeting different proteins within the influenza virus. So I think we're getting closer. I hope that we will have one within the next 5 to 10 years.
Oh, that'd be exciting.
But I'm not sure if that will be a reality or not.
Well, maybe, like I said, that's why guys like you continue to work hard, every day. And the RNA vaccines, correct me if I'm wrong, RNA's basically not using a former version of the strain of the virus. You're actually kind of almost teaching your body how you're introducing and teaching the body, hey, this is something that you may have to fight somewhere down the road. Again, that's a very basic term. Correct me if I'm wrong, but that's basically how RNA vaccines work.
That's similar to how many vaccines work. Even protein-based vaccines are taking a portion of the virus and showing your body and saying, you may see this, so get ready. And so your body can mount a response to the vaccine that will ultimately get boosted if you do get infected and will help protect you from hopefully preventing the infection.
All right, so let's step away from all the infectious disease talk, the influenza talk, the St. Jude cancer research talk, and all this for a second. We're trying to sell tickets to the St. Jude Dream Home campaign. We've seen construction continue to go up on this campus, and it's thanks to the amazing folks that reserve these tickets every year and continue to help these kids and these patients that come here on a daily basis. If you could give a message to anybody at home that is watching this interview right now and they're on the fence about buying a St. Jude Dream Home ticket, or they're on the fence for contributing and donating to St. Jude Children's Research Hospital, what's the one thing you tell them?
I would say definitely buy a ticket. I mean, not only do you get a chance at winning a fabulous house, but you also have the knowledge knowing that you're helping us do our incredible research. And the donor dollars go to so many different things. Like you said, we're seeing a large expansion. I think our strategic plan through 2027 is $12.9 billion, and 80% of that comes from donors. Right. But not only that, not only does it help expand, but it helps us to do our work every single day. So we have probably the best core facilities of any place I've ever been to. We have incredible genetic sequencers. We have numerous electron microscopes that we've used to look at individual virus particles. And the genetic sequencers, we can sequence hundreds to thousands of influenza viruses in a single run. Not only that, they're using them to sequence the patient's genomes. So yeah, the donor dollars go to so many different facets of what we do here.
And a lot of folks probably won't think in the grand scheme of things that a $100 ticket may not go that far, but a bunch of $100 tickets goes a long, long way.
It's very true,
especially when it's part of a country, a universal kind of collaborative effort. You guys collaborate trying to cure infectious diseases. We're collaborating trying to raise money for this place so you guys can continue your work.
And we really appreciate it. Thank you very much for everything.
Dr. Fabrizio, thank you so much for joining us this afternoon.
No, thank you.